I'm Greg Odland, CEO and co-founder of Playback Health. Today I'm joined by Dr. Rebecca Kaul, SVP, Emerging Technology, AI, and Transformation, and Dr. David Langer, Chair of Neurosurgery and Principal Founder of Playback Health. For those who don't know, Northwell Health is the largest health system and private employer in New York State. It's 21 hospitals, I think well over 900 outpatient facilities. I'd like to begin with a question to the audience, a show of hands. I can't see your hands, so I trust that people will raise them. Who considers themselves or aligns with corporate administration? Okay. Rebecca, good. Clinical or patient-facing? Healthcare, IT, or technology? Okay. Undecided? Right now we have an opportunity to take a deep dive into corporate and clinical views at the highest level on AI's potential to redefine healthcare. David, you've had a long and distinguished career, not only as a neurosurgeon, but also as an entrepreneur, a tech founder, and of course a Netflix star. Can you talk about your experience and why technology has been important to you and your practice?
I think I'm an Apple guy, and in the late 2000s I was very frustrated with, I'd see patients preoperatively and I'd show them an MRI and tell them they had a brain tumor. They'd go home, they'd forget what I told them. I had a very difficult time communicating ideas and concepts that were complicated but relatively straightforward, at least in my opinion. And started making recordings for patients, and then started making movies for patients and giving them printed CDs of their MRI with my voice on top. And that's how this sort of started. You know, I think the EMR revolution was great for data, bad for doctors, disruptive for patient care. And I was trying to overcome some of that friction by creating a better EMR, better, more phenotypic, more highlight reel-esque version that took advantage of the phenotype of healthcare and delivered it to the patients. That's really where my kind of motivation was to get involved with IT. It was very like watching my kids do their homework. They were using chat and screen sharing, and we'd go back to the hospital. We were, had nothing. We were just held back by the IT, or it was torture, and it remains pretty onerous. And so I think we're really looking forward to what comes next. And I sort of started this company in order to take advantage of some of these commercially available things and deliver them to the patient space.
Terrific. Rebecca, for many years, you've been an innovation executive at UPMC, MD Anderson, and now at Northwell. Can you speak to our current moment and what is driving technology change in healthcare?
Yeah, I mean, at the end of the day, it ends up speaking to the priorities of your organization and the priorities of the healthcare ecosystem and the priorities of patients. And what drives change is your ability to align with those priorities. So in today's moment in time, the healthcare systems, have very low margins. They need to do more with less, very high demand. Lots of challenges with access, lots of challenges with, capacity, lots of challenges with efficiency. I mean, this is what you hear from every health system, any talk you go to, now's the time, which is how do we make a transformation so that we can do more for less while not compromising the experience, right? At the same time, patients have higher demands than ever because outside of healthcare, patients are experiencing great technology, great experiences in every other sector except healthcare, essentially. And so patients are coming in, and to be competitive in healthcare, saying, this is what I want, and I have choices now. I can go to the next health system. I can go to a concierge care. I have different options in the market, so now the more traditional institutions or the large institutions have to make a change, and that's what makes it ripe now to introduce innovative technology in AI, which is this the panacea that can help us do more for less and enhance the experience at the same time?
Healthcare has always been a field rooted in tradition. How do you see AI challenging or enhancing these legacy practices? Dave, do you want to start with that one as a clinician?
I mean, I think that legacy is a big problem, but more so by the perverse incentives that physicians have and what we're asked to do. And that goes for ACPs as well. I think that the issues regarding this change is difficult because we're asked to do things that are, whether it's for financial gain, whether it's based on what the EMR demands. And so that's where the legacy lies. I think that what's really unique, I think, about AI, at least, I mean, there are two kinds of AI, really. There's what we see, what we can feel like, I'm on chat, I know I'm using an AI module there, but there's AI in our phones now, there's AI in our calendars, there's AI in our emails, it corrects our spelling mistakes. I mean, it's a big, big thing. It's not just one thing, and so we're using it inherently. But I do think for me and for physicians, what I'm so excited about is this ability for things like diagnostics, and I think generative AI and the ambient is a massive, massive thing. And I think getting rid of keyboards, using microphones in the future, I don't think we're gonna have inputs the way these EMR, these cockamamie EMR inputs really should go away. It's all gonna be voice, and we're gonna wear microphones, and you're gonna be able to get data, create data, and learn about things in a completely different format. I think in a very short period of time, we've seen such a rapid adoption of just based on things like ChatGPT into healthcare, and that's just been in the last year and a half. This has been the most rapid adoption of technology I've experienced. I mean, EMR was forced down our throats. That wasn't really technology, but it allowed this to happen. I mean, if we were all running this up, we all hate EMR, most people didn't like the transition, but without that transition to create hard data, we never can go to this next step, and I think this is what we've been waiting for. The first thing, getting off of paper and struggling with checking boxes and this kind of thing, and this very disturbing UI and UX, but this is the moment we've been waiting for. This is when this is going to go from, all the input becomes something valuable, and I even think the methodology of the input is going to change, and that's really exciting. And I wish I was 20 years younger, honestly. I mean, I wasted the last 20 years waiting for this to happen, and so I'm excited about the next 10.
I don't think you've wasted much. Rebecca, it's kind of interesting that you now have a title that speaks to emerging technology and AI, which 5 years ago we wouldn't really have thought about that. But how do you think about technology pushing the boundaries, risk? What does that look like for you and your job?
Yeah, I mean, it's the classic give and take. As we talked about, healthcare tends to be the industry behind, and it makes sense because healthcare is the industry where people's lives are at stake. The stakes are as high as they can be, which makes this industry relatively risk adverse. It's also one of the only industries where the payer is not the customer. And that separation also creates an interesting dynamic because are you fulfilling the needs of your customer or are you filling the needs of the person paying for the care? And it's kind of a strange separation. I think now we are at an interesting juncture where we can start to close that gap using technology like AI. I think you see the experience everywhere else. You see that it works. In healthcare, the question becomes, how do you speak to the audiences that are risk adverse, that are going to be very concerned about health disparities, ethics, does it work, does it put people at risk, does it put our data at risk, ... You can sit for hours in that conversation, and you can sit for the same number of hours with someone like David and talk about all of the possibilities of how it can make people's lives better. And so the question is how do you chart that journey from high risk to, fulfilling, checking those boxes, to realizing the art of the possible. And I think part of that, I think we heard it in the last talk, is starting with some of those low-hanging fruit, starting in areas where the stakes are a little bit lower, to prove out the technology, to gain the support, potentially to establish some financial benefits for the organization, because that tends to be a pain point in today's day and age. to move towards the art of the possible.
Earlier today, Rob Allen, CEO of Intermountain Health, spoke about the importance of collaboration in healthcare. There's often a tension between the clinician's need to personalize care and the corporate push for efficiency and scalability. It's a little bit of a softball pitch here, but is AI a tool to bridge this gap? And what does successful collaboration look like, Rebecca?
I mean, yes. I think the short answer is yes, because AI, is at the place now where it can process a lot. This isn't your mother's AI of 10 years ago, where everything was kind of procedural and, writing out rules and working through the linguistics. Gen AI has changed the game, where it can process a lot and it can do a lot, and kind of the sky's the limit. So the question becomes, can you point it at problem areas to create those efficiencies, to give those kind of operational ROIs, and at the same time start to improve the broader experience of both your workforce and your customer, your patients. And I think the short answer, which I just made long, is actually yes. I think that AI becomes the bridge to take those two conflicting viewpoints and be able to actually chart that journey.
I just see it a little differently. Just like we're all worried about AI taking our lives away and taking over the world, there's a very real possibility that this will really impact the need to hire more doctors. It's going to simplify things like hospitalists and ER doctors, radiologists, pathologists. This is a massive thing. That's why I think it's lots of different colors. It's a rainbow of things that AI does. And I think there's a realization amongst physicians that procedurists will be okay. People who are in the more the thinking business, there's probably going to need fewer of them, which is probably a good thing. But the best doctors will be the ones that use AI the best. It's just like chat. Authors and writers, everybody's all freaking out about this stuff, but we have to be, as humans, we have to take advantage of it as a tool. And I do think the corporatization of healthcare is a fear we all have. And ultimately, I'm taking care of patients every day. That's why I became a doctor. We don't want that unique thing taken away from us. And if AI can help us be better at what we do, then we're all for it. If it's going to diminish us, if it's going to demoralize us, if it's going to dehumanize us, if it's going to take away the essence of what it means to be a physician, then obviously we're going to push back hard. But I don't see that as the final straw. I think it's going to be a super interesting ride, and I think in the early phase we're going to see it all be mostly positive, just like we're seeing chat as mostly positive in our lives right now in the consumer space.
I would say it would empower us.
Empower us, yes.
It's really interesting because when we think of provider adoption, at the end of the day, if it doesn't help you achieve that goal of treating patients better, you're not going to use it, right?
Well,
so maybe that's...
It's even whenever you look at data, you have the data, you have the input, you have the algorithm, you have the output, and then it's completing the circle. Like, if I'm a doctor and I'm an intensive care doctor and I get some AI bot that tells me, oh, this patient's high risk for sepsis, this is what you need to do. That hasn't happened yet. Completing that circle and how that works, and we have to trust data accuracy, we have to trust that it works, like the prior speaker mentioned the sepsis model in Epic. Hasn't been so great. So there's going to be some testing that it's going to happen. There's a certain inevitability to this, and I think we're excited about it. It's just like anything else, there'll be some, 2 steps forward, 1 step back, and I think it's all of our responsibility to take advantage as much as possible, because no question, it's super powerful. There's absolutely no question about it.
So David, you navigate being both a clinician, a neurosurgeon, and a tech founder. How has your experience informed the AI innovations that you're pursuing?
It's been terribly frustrating. I think that's not to say that shouldn't be. That healthcare is, as Rebecca mentioned, inherently conservative. I have ideas every day. If you kept changing everything, you've got to prove things, and I'm just very impatient because I just see there's such an opportunity for us. But not physicians aren't all like me, and not everyone is willing to spend extra time on doing something that may not work. And failure is part of the process. I enjoy that aspect of things, not as necessarily as a neurosurgeon, although that's part of my life too. And hurting people, I'm remarkably sensitive to what I put myself and my patients through, and I take risks. With AI, there's probably, or with any technology, there's probably more risk, and meaning failure or no failure, but that's just your ego and your ability to keep coming back. And I think that really for the first time since I've been trying to do things in IT, I feel this is going to happen. And a lot of us do with people like Rebecca. We didn't have an AI officer at Northwell up until 2 years ago. And to have, I think healthcare has adopted this. We have a whole digital transformation team at Northwell. I mean, we were thinking about this in the late 2000s, 2010, 2011, and now it's actually coming to fruition. So I'm really excited because some of that friction and resistance is melting away, and I'm enjoying being a part of it. It's really great, and we're going to see some, I think, massive change in a very short period of time.
All right, Rebecca, this is a little bit harder question, and you have to answer it.
Pass.
At the corporate level, what are the ROIs you most care about, and how do you drive them through the rest of the organization while maintaining respect for the physician-patient care process?
So this is always the literally million-dollar question, particularly when you're in the middle of your budget process. Because when you're in the middle of your budget process, I don't know how many of you are in these roles, but you go with all of these grand ideas of all these great technologies that are going to change patient care, change the physician experience, etc. And you're always oversubscribed by like 50% on the budget, so then comes the process of squeezing into the box. And when we squeeze into the box, the reality ends up setting in, which is the things that you can quantify financially in terms of ROI are the things that are much more likely to fit into that box than the things that have a more unsubstantiated ROI, which makes it very difficult for a person in the role of emerging technologies, because almost everything we do is hypothetical, because if it was proven, it wouldn't be categorized as emerging technology. So you're kind of in a catch-22, and you have to argue for the promise, but to the extent that you can model it quantifiably, that ends up being what wins. And that's the reality, where we talk about the debate between the emerging technologies and, what people want on the ground, how it funnels up through corporate, is you have to find a way to translate the exciting opportunities on the ground into something quantifiable, to be able to fit in the box, in the process, to be able to move forward with. And I think, so I think my message on that is anything you can quantify financially, even if it's a model, even if it's a hypothetical, becomes much more likely to be able to pursue. If you can pick your first use case in that direction, then it gives you, and it pays for itself, then it gives you carte blanche to do what you want in what I would consider the much more experiential and much more experimental work.
I always push back at you about this.
I know.
And I think it's a bunch of, I honestly don't agree.
Yeah,
and I'll
I
say
know.
this audience. I think you're right about the core, that's the way you manage IT in general. Mm-hmm. And I know we have to behave that way, but I think the healthcare systems that are going to win, and I'm not saying we're going to, okay, mm-hmm. are the ones that don't do that. That actually find different ways of taking risk and saying, what, there's such a dynamic area. You're right, we don't know what's going to work. We've got to keep throwing the ball against the wall because you're going to miss it, and the value, potential value, risk to benefit is so high that we have to do that. And I've my own example as a scientist. I worked on RNA therapy in the 90s with a woman who won the Nobel Prize last year, and no one gave a crap about it because they didn't see it. And yet it was probably one of the biggest innovations that ever occurred in science this century. So, I think we have to be willing to take some moonshots. It doesn't mean you have to throw all the baby out of the bathwater with your budgets and all that crap. But leaders in healthcare have got to recognize this is a really, really unique time. This isn't just like the EMR. It's not even like the internet. This is so different. And We need to be able to do that, and it means we have to take some risk, and we may not make the money back right away, but I really fear that we'll lose in the end by not doing that right now. It doesn't mean we have to do that in 10 years. I think some of this will be sussed out by then, but I'm not in charge, so I can say whatever I want. But that's just a bias, and because I see this as a very, very unique time. It really is. I urge all of you to think that way. This is very, very different from the clinician side, and I challenge you to make those changes in your organization.
Well, we're at time, so I wanted to thank you, Dr. Kaul, thank you, Dr. Langer, thank you, Reuters, and thank you everyone for being here today. I hope you enjoyed it.